What we do matters. People in Northern Michigan count on us to be here whenever and wherever we're needed.
What we do matters because we offer people hope.
I help keep the children in this community safe.
When people come up and they'll say, "You flew my parents, my son, my daughter," it's just a great feeling to know that all this effort, works out.
What I do matters because I make people feel better.
I bring comfort to patients when they're at their worst.
I can make somebody's day a little bit happier.
What I do matters because I need my patients as much as they need me.
What we do matters, period. And we're happy to do it.
Sharing our strengths and working together is the best way to prepare for the future. What we do matters. What we do next will determine what we'll be able to do tomorrow. Finding good partners is imperative. By partnering with Helen DeVos Children's Hospital in Grand Rapids, pediatric oncologists are providing care locally to children with cancer.
It's very important for hospitals to work together and partner together because it's the right thing to do for the patients and their families. Munson has been great in terms of partnering with us.
It means a lot to us because we live in Petoskey and it's closer for us to come here than it would be to go to Grand Rapids. Maddie was diagnosed December 2007 with acute lymphoblastic leukemia. The first thing that went through my mind was that she was dying. It's 3 years and she's doing great.
A couple more years before we can say she's cured, but we'll get there, right?
Through a partnership with Michigan State University Medical Schools, we're training tomorrow's physicians and introducing them to Northern Michigan.
I think the experience I've gotten has just been invaluable. I'm rounding with 4 different intensivists, and that is something that you don't get in a traditional medical educational environment. The opportunities and the quality of teaching that we have at Munson is just amazing to me. I think it's important for a hospital like Munson to attract newer, younger medical professionals who are going to come here and say, this is a wonderful hospital, a wonderful place to live and to work, and having them eventually stay and be contributing members to the medical and the greater community.
We face growing challenges that increasingly call for collaboration. Regional efforts are focusing on surgical safety, obstetrical care, early identification of deadly infections, and rapid transport and treatment of heart attack victims.
All Northern Michigan hospitals are participating in this initiative to make surgery safer for our patients. The most important change that we have made is standardization. Everyone is communicating better. It makes it a much safer environment.
Sepsis is a very severe infection and the body's responses to that infection. This is a diagnosis that kills. What I'd like to see from this meeting is standardization of protocols, that we all recognize early sepsis and intervene early.
If we can come together in Northern Michigan with all the hospitals and all the providers to give the patients the best care possible, everyone wins.
Over 70% of the counties in rural Michigan do not have obstetrical services, and most of those counties are actually in Northern Michigan. The situation became more intensified in 2010. 2 hospitals in Northern Michigan made the decision to close their obstetrical services, primarily because they could no longer subsidize that care.
We are all facing the same challenges. The bottom line is that people are going to continue to have babies and people are going to need care, and we all have to work together.
Most serious consequence from a heart attack of this order is that people will die, and a lot of people die very early in the process. Getting into the hospital quickly becomes imperative. It's really very exciting when we get so many people from so many different agencies and from all the different hospitals. They all understand that we're all moving towards getting the patient the best care possible as rapidly and expeditiously as possible.
Here at West Shore, our STEMI initiative has greatly improved our door-to-transfer times. We now have patients out within 15 to 30 minutes.
Good. I'm glad to be a part of this. This is the best thing that's happened since I've been working.
Community needs often extend beyond hospital walls.
On a weekly basis, I see patients that tell me that they can't get their medications.
Our patients are really struggling. It's so hard to afford medication when it costs $15 a pill sometimes.
We decided to come together as a medical staff, work together with the hospital to develop a meds program.
We talked to our partners, Munson Medical Center and Munson Family Practice and Mercy Cadillac, to
look at their programs and create a program that would work for all of our patients here at Kalkaska. We've been fortunate enough to help 80 patients so far since April and dispensed over $108,000 worth of medication to them.
On a tour to the Goodwill Inn, I realized immediately that they had some medical issues that they were not able to handle, that if we collaborated with Munson Healthcare that we could meet those needs. The Goodwill Inn Triage is a collaboration of the Munson Home Health, the Traverse Health Clinic, and the Goodwill Inn. It meets the needs of the homeless in this area, and it also decreases the emergency room visits that may not be necessarily emergent.
Maintaining top quality care and keeping patients safe requires ongoing facility upgrades and major investments in emerging technology.
We're about to break ground on a $14 million enhancement to our surgical services department. It will lead to both an addition and renovation and bring 21st century surgical care to Cadillac. We expect that patients will see an increased level of satisfaction and privacy here at Mercy.
I was scheduled in January for an MRI in Traverse City at midnight, which is not very convenient. We're planning to have a new MRI doc here at Paul Oliver within the next year. It's very important for our hospital to invest in the latest technology so we can offer these services to our residents locally.
I'm absolutely thrilled to be able to offer the Da Vinci robotic surgery system to our patients here in Northwest Michigan. What it lets us do is it actually takes the surgeon inside the patient's body. I can take a needle in a needle driver and I can put it through tissue, grasp it, pull the suture through, and then tie the knot just the same as I can outside of somebody's body. I really don't think there's any reason to go downstate anymore. We have the technology here, we have the experience here, and we have an excellent team at the hospital that is trained in the use of the robot.
Munson Healthcare invested in these smart pumps because we know that they save lives, and really, you can't put a price on a life. This is a very high-tech pump that has software built into it that has limits set on every drug that we give intravenously. And when a nurse programs this pump, if she's exceeded that limit, the pump stops her. So it's a safety net to protect patients from a simple human error, punching one too many zeros.
We're here for patients every minute of every day.
I had some shortness of breath, some back pain, not much of a chest pain, but I had my wife and daughter bring me up to the Kalkaska ER. They took me in immediately, hooked me up to an EKG, got an IV started. At Munson, of course, they had all the information there already because of the networking that we have now between Munson and Kalkaska.
If it wasn't for my nurse that was taking care of me at Munson, I would be dead today.
She came in and she said, "Dave, you don't look good, but everything looks all right on your monitors, so I'm going to get your doctor in here." And then from the time she said that until the time that it actually came in, I lost consciousness. They had to do an emergency bypass. And I told Dr. Sterling when I was being discharged, "Thank you for saving my life." He said, "You know, in most cases we can't really say that, Dave, but in your case we probably did."
What Max has, it's called supraventricular tachycardia. About 2 weeks after he was born, I lifted up the blanket and he had gone blue and yellow. My father and I drove up here, brought him in, came straight back. He was on this bed and they were trying to get vital signs for him. Denise, the physician's assistant on duty, was on the phone with Munson, saying, "Okay, do we need to bring this baby up here?" And he said, "Well, no, we need to get him to DeVos because we don't have the facilities really to deal with this at the moment either." The doctors at Helen DeVos said that the ER staff at Paul Oliver did absolutely everything right. We didn't have an hour, we had minutes, and the outcome would not have been the same if this facility wasn't available to us. They saved my son's life, and there's, I'm just forever grateful.